No one needs to tell you that life has changed dramatically this century. Technology and breakthrough scientific research have played a major role in longevity today. Whether all those breakthroughs have been positive or not, well, the jury is still out. Hello, I'm Julie Anderson, a journalist with a passion for sharing information so baby boomers and their families can live happy, healthier lives. Now, there are those who say Alzheimer's disease is a trade-off to living longer. And there are those who say early onset dementia can strike people as young as 30 years old. I don't think it matters which one is right, or maybe both arguments are right. The bottom line is dementia-related illnesses are here to stay. Before we dive into the deep end, let me tell you how this program was made. Each person was interviewed separately in a separate location. This was done to ensure that their answer was not in response to what someone else said. So let's get started. First, what is dementia?
When doctors talk about dementia, what they really are referring to is a gradual, irreversible loss of previously attained cognitive function. Now, each of those parts of the definition are important, and each of them helps us understand what life with dementia is really all about.
I'm not a physician, but to my understanding, the term dementia refers to a group of symptoms, which are memory loss, confusion.
There are some that think that this is a disease. There are some that think this is a process of an aging brain. There are some that think that they're not sure what to think, and those people are in the majority right now. But I'm living with the sentence, whatever that means, of having dementia, probably of the Alzheimer's type.
Well, I start with my definition of dementia, which has nothing to do with plaques and tangles and changes in the brain. Those definitely occur, but when we just look at the physical brain changes, it limits us to seeing possibility, to seeing inner strengths that people maintain long into their lives with dementia. So I have a very simple definition. Dementia is a shift in the way a person experiences the world around her or him.
Are all dementias the same, Dr. Thomas?
The answer is no. Dementia describes a pattern of change in the mental status, mainly of older people. But there are many different patterns, just like there's different colors in a pack of crayons.
Dementia is the catch-all word, and all these different forms are really probably words. You probably have Alzheimer's. Many people are re-diagnosed, for instance, who are originally diagnosed with dementia of this type or that type.
We have heard the words caregiver and care partner. What do they mean, Dr. Power?
The word caregiver implies a one-way street. This person is broken, they're incapable, and I'm giving care. And that creates problems for both ends. And I first learned of this concept from Christine Bryden, who's from Australia. And Christine herself was diagnosed with dementia at age 48. And she wrote a wonderful book called Dancing with Dementia, in which she introduced the concept of care partnering. And I like to use the word care partner instead of caregiver. And this is the way Christine explains it. I'm paraphrasing it, but basically she says that if you accept separate identities as a caregiver and suffer of a disease or illness, then you create separate identities which erode the well-being of both people. The caregiver sees themselves as having to do everything for two people, planning for two people and organizing and problem solving and doing all the work, and that leads to exhaustion and burnout, and they're getting nothing in return. The person who lives with dementia actually gets learned helplessness, excess disability, because everything is taken off their plate, and they're basically being told in a kind way, you can't do anything anymore, I'm going to do everything for you.
When we go to the doctor, we may think we're prepared, but no one is really ready for an unexpected diagnosis, especially one involving a terminal disease. So how then should a doctor relay information about a diagnosis involving Alzheimer's or dementia?
My answers to this question are based on the negative experiences my family had when my father first started having symptoms of dementia. So I can tell you what I don't want a doctor to do. When she's communicating a diagnosis or lack thereof, I don't want her to brush off my symptoms and tell me there's nothing wrong with me. I don't want her to communicate the diagnosis by sending a letter. And I don't want her to make the diagnosis based on her research specialty instead of my symptoms and test results.
After the initial shock of the diagnosis, more questions are likely to occur. Questions like, what role should you take in planning treatment?
It was impossible for me to step outside of my doctor's office and into my own home and start developing my own treatment plan. I was crying too much. I think it's impossible for most people to do that. I think the emotional trauma of being diagnosed just has to run its course, at least to the point where you can pull yourself back together.
I think whenever possible, the person with dementia and his family or his care partners should take an active role in planning treatment. In my family's case, it took us a while to learn to ask the doctors about the potential risks and benefits of each treatment and each test. But once we asked the right questions, it became clear to us and to the doctors that some of the medicines my father was taking were more harmful than helpful. I think also looking back, I wish we had talked more with my father when his symptoms were mild, to better understand his general feelings about treatment and care that he would like.
I began to think, for the two of us, that we probably know the end of the journey better than we know the path. But the path is one that we can learn if we really love each other and want to care for each other. And strangely enough, it didn't take too long before even the fear was gone. And the joy of caring for someone you loved became the issue. I saw my husband change. I saw fear in his eyes sometime. However, it was never a thing that when we discussed even Alzheimer's, and one of the times when he said, but we don't know anybody that has that disease.
Is there a need for someone with dementia to enroll in a clinical trial?
I don't mean to sound like a broken record, but my answer to this is the same answer I have to many of these questions. You decide. It's really up to you.
Well, being part of a clinical trial actually requires informed consent. And the question is, can the person in question give informed consent? In many cases, a person living with dementia can do just that. It is possible for a person living with dementia to understand two alternative courses of action and decide on one of them.
But ultimately, I remain somewhat pessimistic about drug studies simply because we don't know what causes the various forms of dementia.
Why do people resist accepting a diagnosis?
I believe people resist accepting the diagnosis because diagnosis of Alzheimer's is frightening because of all the negative media and the certain videos that are out and people talking about the long goodbye, and I think they're scared.
It's never the statement that you want a doctor to tell you. You do want him to say you're perfectly healthy, not even arthritis or anything, that you're perfectly healthy, but sometimes it doesn't come like that. So I remember that night, my heart was so filled with, will we be able to do it? It was fear. It was denial on my part. It was denial on my family's part. But it was such a need for us to feel empowerment so we could do it.
One of my main contentions, I guess, is that our world of care for people with dementia is very inadequate to the needs of these people. We tend to rely on potentially harmful or ineffective medical treatment. We tend to have people hold out for cures, which may not be soon in coming. And for those who are not going to be cured, we tend to put their lives on hold because we don't feel that there's much else to offer. As a result, we tend to disempower people, we stigmatize them, we isolate them, we over-medicate them, we often institutionalize them. And this actually creates excess disability. It creates a world where a person is even less successful than their brain illness alone would cause. And this is an unhappy existence, and we see it for the people we've known and the people we've loved who have dementia. And as a result, we are fearful because we see this as the type of life we're headed for.
People are fearful that the diagnosis is going to lead them immediately into a life no longer worth living.
What about hope? Dr. Power, fire away.
Specifically, the question is framed with additional questions about what about hope for the cure for Alzheimer's or for some other form of dementia? What place does that play, if any, in the lives of people who live with dementia?
Sometimes we want simple answers to complex problems, and this is encouraged by the exaggerated reports of breakthrough treatments and cures we see on TV or read in the newspapers. But I think this kind of magical thinking can stop us from seeing what we can do to make things better, both on a personal and a societal level.
Hope is a double-edged sword. I think that all of us like to have hope for something better. That's what keeps us going. It's what gives us an inner drive. But by the same token, hope can be damaging if we are hoping for something so much that we forget about living for today. And part of the problem with hope in Alzheimer's is that all the hope has been placed on the fact that maybe some pill will come along that will change everything, that will make everything go away.
And to me, hoping is something that happens way up high intellectually. When that's an area we're having trouble with to begin with, we need to live in today. We need to say, well, I hope they find a pill for this too. I hope they find a cure for it. And I do. But in the meantime, I have to live as if there's no cure today and some truck maybe come right through this plate glass window here and kill me.
It's very exciting that we can do much better than we've done in the past at helping people who are diagnosed with dementia experience daily life in a way that is rich and deep and meaningful.
Wouldn't it be lovely if everything in life came with a blueprint? We would know how to solve every situation life throws at us. For example, what are the best practices for care partners, professionals, and people with dementia?
I think one of the best practices is people who realize there are no best practices. That is, every practice has to fit between you and I. There are some things that you can do that are better than other things, but there's no best practice. There are better practices.
It is our hope this program has been informative and helpful in answering the many questions that you have. Remember, the comments from each individual in this program are their personal opinions. The program was designed to give you information from various points of view so you can make your own decisions. Keep in mind that if you have met one person with dementia, you have met one person with dementia. If you have a pressing topic about dementia and you would like us to create a video about it, please email us. I'm Julie Anderson, and I'll see you in the next series.